ladies and gentlemen, colleagues, our esteemed panelists, a very warm welcome. I hope coffee has made you warm. A warm welcome to this session of the 7th critical niche area, natural sciences and biotechnology. The session is titled Translating Natural Science and Biotechnology into impactful solutions. I underline impactful solutions. And what role can universities play, or should university be playing, particularly UNISA? So as we know, biotechnology cuts across agriculture, industrial processes, the medical slash health spheres. So we cannot tackle everything in this 1 hour. We have decided to zone in, particularly in the health biotechnological space. Having said then that, though, it doesn't stop us to go across, because as you shall hear, we have gurus here in the biotech industry who have straddled across all the spheres. So we want to find out what are the critical societal challenges that are facing our societies that we need to find solutions for. And we have someone who's going to share from the ground experience what the challenges are. And we are going to find someone who has struggled across all the ecosystem of the biotech and innovation and commercialization space. And we are going to hear from the strategic, the policy, the national priorities, and the funding. So I believe we have a very rich and excellent lineup of panelists, and I urge you all to take this opportunity, bearing in mind the outcome. We want to find out and align our research. Our topic actually speaks to things that have been mentioned time and again from yesterday. Our VC highlighted how we are low in societal impact, how we are low in innovation, commercialization of our research. So the essence, the core message that we need to come out with is, what are we going to be doing to close that gap between our research and what impact we have on our societies? It's paradoxical that South Africa has advanced in the biotechnological and innovation space. We have so many resources, and our government invests a lot, both in the funding space and also in the resources. We are here because we're subsidized. We have researchers, we have the infrastructure. I was chatting to my ex-colleague, when I came from UKZN, they were asking, you're going to UNISA, but it's fully online. What will you be doing there? Because you are lab-based. And when I came to the Florida campus, I actually took photos and sent them to the person who was there. So we are highly resourced in all aspects of biotechnology. And we now need to close the gap, not only to do research for publications and promotions and increase our site scores. We really need to impact our societies. And no other time like now, we have seen how it is if you want to solve your problems using another person's resources. When the people say, I am taking my toys now, you don't want to be left wanting. So the purpose and the essence of this session is to hear both from the policy, the national priorities, and what is there in the ground, and learn from the gurus, as you shall hear from their brief bios, how they have struggled across academia, innovation, commercialization, and learn and find out what it is that we need to be doing so that our research doesn't end in site scores, and sometimes it collects dust as thesis in the libraries. We really need to have impact. So I am just going to give a high-level overview of these very powerful panelists. From their bios, please allow me to ambush your bios so that we can get to the gist of the session now. I will start off, I will introduce all of them so that we don't waste time transitioning in between. I'll give their bios, they will give their presentations, and then I will give them a few questions to respond, and then I will open the session to the floor. Thank you very much. By the way, my name is Zilungile Mkize Kwichana. In our culture, you give your name at the end so that you don't want to sound important. Thank you very much. I will start off from the policy, national priorities perspective. We have amongst us the Chief Director from the Department of Science, Technology and Innovation in South Africa, Mr. Ben Durham. He is responsible for the implementation of the South African bioeconomy strategy, the ultimate purpose of which is to ensure the strategic, socio-economic, and environmental benefits from bioinnovation. He is also serving on various local and international bodies, including the International Advisory Committee on Global Bioeconomy, and is leading the charge on the bioeconomy initiative under the South Africa's presidency of the G20 in 2025. So we have a wealth of expertise from the policy frameworks, from the national priorities, and the global perspective of the bioeconomy in Ben Durham. And then we have Dr. Nhlanhla Msomi. He is one guru who has done it all in the biotech space, from academia, research, innovation, commercialization, biotech leadership, and partnership. I'm just going to take a few highlights from his bio. Currently, he spans across research and development, academia, innovation management, policy, corporate finance, and entrepreneurship. All of the expertise that we need in Unisa. Currently, he is the executive director of UKZN Health Consortium. He is also a non-executive chairman and president of Africa Bio. We know Africa Bio hosts the Africa's biggest biotechnology innovation convention. I think this year it's coming in November. He is also the chairman of two South African health biotechnology companies, namely Next Biosciences and Cape Bio. He has served, among others, on the boards of the CSIR, TIA, the National Advisory Council on Innovation, International Center for Genetic Engineering and Biotechnology, and the International Council of Biotechnology Associations. He also served as the board chair of the Innovation Hub, a board member of the Gauteng Growth and Development Agency, as well as the KZN Trade and Investment Board. He's the former president of the South African Society of Biochemistry, Molecular Biology, and Biotechnology for a term. He also managed he served on the investment committee of Quantum Global Health Fund for Africa. As an early leader in National Innovation System, he was the founding CEO of the East Coast Biotechnology Regional Innovation Center, namely Life Lab, and the interim CEO of the Technology Innovation Center. His bio is quite extensive. He is also a co-author of seminal works in biotechnology, namely the Ethical and Legal Guidelines for Biotechnology Research in South Africa. He is also the co-author of the National Bioeconomy Strategy and the report of the National Consensus Panel on Biosecurity and Biosafety. He's been a co-founder of several companies, including the Biotechnology Investment Holdings and a series of other biotechnology ventures. Until 2018, he was the group CEO of MSQ Health Group, a company he co-founded with several subsidiaries. And he has also served in various advisory capacities for government and international healthcare organizations, including the WHO's TDR, where he was the founding working committee. I deliberately extended his bio so that you can see how he has cut across academia, innovation, commercialization. So I urge everyone to engage as much as we can. Last but not least, we have someone who has a wealth of experience, Lisa Stradom, on the ground, because this is where we really should be having impact. She has public health advocacy and she takes care of the society. Lisa Stradom is a social worker by qualification. She got her social work degree at Wits. She then went on to do a master's degree in theology and development, very pertinent qualifications. She has 26 years experience working in the NGO sector at the coalface of where the challenges are. And on the 5 years, she has been involved in supporting children and teenagers, developing income-generating projects, working with communities on various community development projects, low-income housing projects, supporting people with HIV and AIDS, and working with people affected by cancer, a very interesting continuum between infectious and non-infectious diseases. So her wealth of expertise is commendable. She has worked for the Cancer Association of South Africa for 12 years in various positions, and she has been a board member of an NGO, the Tandanani Children's Foundation in Pietermaritzburg, for 13 years, including chairing the board for 3 years. And for 13 years, she has been an administrator for the Morris Webb Trust, which allocates funding for race relations projects in South Africa and Zimbabwe. Currently, she is the national manager for care and support in the South African National Cancer Association. So ladies and gentlemen, as you can see, we have a wealth of expertise in biotechnology, also in the challenges that we need to be addressing. So without further ado, I shall call upon, and they will come in the order they are sitting so that we save on time. They will give their presentations, and then we'll explore some questions, and then we'll open the floor for questions and engagement. Thank you very much.
Good morning, all. Thanks very much to Prof. Mkhize Kwachana for the invitation. And I see my presentation, and I've pushed my 10-minute time. So I'm representing the Department of Science, Technology, and Innovation, and really appreciate the opportunity to engage with this. It is a really important task to make sure that the university's outputs are not just academic, they are impacting. So thanks very much for the invitation and your introduction. So we here in South Africa, we have a bioeconomy strategy, and the ambition of that strategy, it's now 10 years old, it's time for an update, but the ambition of that 2013 strategy is to be a significant contributor to the country's economy by 2030. We want to ensure that there are novel industries, bio-based services, products, and innovations and technologies for established companies, all of these things and many more that contribute to the South African economy through SMMEs, through skills, through technologies, and through increased competitiveness. So under the strategy, there are 4 strategic areas: agriculture, industrial and environmental biotechnology, health, and indigenous knowledge-based technology innovation. We've done a review of the bioeconomy sector in South Africa. It's not a sector, it's a cross-cutting theme. But this is a preliminary estimation. We are at least 8.3% of GDP. We employ between 1.2 and 1.5 million people. And in the formal statistics, we only have between 13 and 28 biotech companies, but that's in the formal statistics. What my department generally does is support SMMEs who haven't yet become established enough to register on the established Stats SA database. So we know that there are at least 240 odd startup companies in our system. And as Lungi has indicated, we are highly competitive in terms of biotech innovation. In the Global Biotechnology Scorecard, we rank 30 out of 100. Our gross expenditure on R&D is 0.6%. It's pathetic. It's terrible. Government aim is 1.5%. OECD average is 3% of GDP. But nevertheless, at our 0.6% of GDP, we are beating countries in terms of innovation in biotech that have a GERD of 1.5%. So we are punching well above our weight in terms of what we're investing. We are focusing on health challenges here today. There are many other things that I could talk about, but we're trying to limit it. The top 5 causes of death in South Africa: HIV and AIDS, cerebrovascular diseases, lower respiratory infections, ischemic heart disease, and tuberculosis. Mother and child care and mental health remain significant challenges. This is determined every few years or every several years under the Medical Research Council, and this is a key indication of the challenges that we're facing in health. We spend about 8% of GDP on healthcare. 70 to 80% of our medicines are imported, and 98% of our active pharmaceutical ingredients, the really important part of the medicines, are also imported. So what South Africa does is the fill and finish. We import the raw materials and we put them together and we package them and sell them on. We are not great manufacturers of medicines. Only 15% of South Africans have healthcare insurance, medical aid. So the bulk of the people in South Africa are reliant on the public health system. We're all aware that the National Health Insurance is a universal healthcare development that is not yet being implemented, but it is being examined quite closely to find ways of implementing it. It's likely to cause an increase in the spending, at least initially, but obviously the long-term objective is to reduce individual costs overall, so that there will be a savings in our public sector spending. As much as 70%, this is an estimate, of drugs that we use in South Africa do not work precisely as prescribed. So they can either be minor side effects, or they can be major side effects, or they can actually compound the problem that the person is being treated for. This is not unique to South Africa, but it's a Southern African region that is feeling this particularly badly. More general health challenges, security of supply is a major problem. If we're importing all of our medicines and vaccines, security of supply is a major challenge. We felt that with COVID, trying to get our hands on vaccines. So pandemic preparedness is a critical and growing issue that we want to be on top of. We also have One Health challenges. One Health is the amalgamation of all health-related issues from the agriculture, environment, and our own challenges. We're not trying to support healthcare in any other country other than our own, but obviously there will be knowledge and spin-outs that will affect the region and globally. We provide support for the development of diagnostics, therapeutics, vaccines and biologics, medical devices, API manufacturing, and as I said, this is all related to the South African burden of disease. Our key instrument that we have is the Strategic Health Innovation Partnerships, or SHIP, that is managed by the South African Medical Research Council and supported by ourselves, the MRC, Department of Health, and various philanthropic organizations. A key strategic drive in the health innovation space, and I'm nearing the end, is looking at new treatment and prevention technologies. If you can prevent disease, obviously you're going to have a greatly reduced expenditure on healthcare because you don't have to deal with the patients. And the growing knowledge in nano, bioinformatic technologies, medical informatic technologies, provide new and many times more effective ways of treating diseases. Digital health is another way of catalyzing healthcare solutions. The convergence of digital technologies with health and healthcare allows us to be far more efficient and effective in the delivery of healthcare. So that's another key area we're investing in. And ultimately, precision medicine, looking at the interface between the genomes of the South African people with the provision of treatments is becoming more and more critical. And I think I'll talk about that in the next slide. No, I won't. The other part of healthcare that we face is also looking at indigenous knowledge and technology innovations from such indigenous knowledge. This is trying to interface the worldview of knowledge holders and their communities with the science system. There's not one superior structure over the other. They are both critically important in developing indigenous knowledge, and we have established 6 platforms looking at African natural medicines, cosmeceuticals, nutraceuticals, health infusions. And then because we're dealing with knowledge holders and their communities, very often there's a need to introduce them and assist them with incubation and commercialization. So 2 further platforms there. So what does South Africa need from our perspective? And I have a few seconds left. We need to develop the precision medicine approach. We need a database of South African genomes in association with phenotypic and clinical reports. We have to deal, though, with the POPI Act, the POPI Act, which says that you cannot divulge information, personal information commercially, so you have to keep that information anonymous. And if you're dealing with genomes, obviously you can identify the person. This is a challenge that we've got. We want to dramatically increase the knowledge of diagnostics and treatments for the varying genomic populations, and we want researchers and entrepreneurs to develop diagnostics and medicines tailored to the South African genome. So this is going to be a key area, although precision medicine can be more expensive. Once we have this database, we will be able to apply medicines to a population group much more effectively. So we will counter that 70% of drugs that don't work exactly as prescribed by making sure that we are dealing with the genome of interest that the patient has. Secondly, pandemic preparedness. We need to expand and coordinate our monitoring and surveillance. We need the system to be developed for pandemic awareness, and we need to increase and improve our ability to manufacture vaccines, particularly. And we have the BioVac Institute, we have the mRNA hub both in the Cape, that we need to expand their ability to produce vaccines. We're dealing with the triple challenges of poverty, unemployment, and inequality. So this is all looking at how we juggle all these different balls in the air to make us more effective. We have multiple partners. We have set up multiple platforms that support the system. I'm not going to go into that detail, and that's where I'm going to end it. Thank you very much.
Thank you very much. Then thank you very much. There we are, colleagues. I'm sure we saw exactly what we need to be doing. We have the resources. UNISA is part of the Africa Genome. We have the sequencing platforms. It cuts across all our spheres. We're also dealing with poverty. As he has said, it's poverty, inequality, and unemployment. So each and everyone sitting in here has a role to play. I've been hearing 4IR is the father of them, is the mother of them all. We just heard now how Marine is, I think health is the mother and father of them all, because even with artificial intelligence, you still need the natural intelligence. So we need the healthy people. We need to feed them. We also, biotechnology is also agriculture. We need, it cuts across everything. So I think we are taking note and we are getting exactly what we need to be doing as UNISA, which is the core outcome of this symposium. Thank you very much. Over to you, Dr. Msomi.
Good morning, everybody. Ben has stolen my presentation, so I only have about 4 slides left. He generously left me 4 slides. I'm going to try and be a contrarian, because innovation, I feel, is one of the most abused terms. It's overused, and thinking about this presentation yesterday, I was thinking that which institution in the country could help in defining or crafting a philosophy or a scholarship of innovation for the country. And it turns out there's only one institution that is named after the country. It's UNISA. So perhaps there is a challenge there to assist in crafting a scholarship of innovation that is geared towards helping our continent and our country. And in this manner, I'm thinking of things like innovation for the global south, because a lot of our innovation is anchored by research, science, and technology, but that research comes from the global north and reflects the ambitions, the needs, and all of that in the global north. And as a result, that's why we find ourselves outside what should be our home. But we're here and we don't have solutions to our health problems. I think somebody, oh, next to me, Lisa, I hear she works in non-communicables in cancer. One exercise that I would like one day for UNISA or one of the universities to do is to do an analysis of what cancers our researchers are looking at. It's a fascinating picture. When you look at the cancers that we are investing our basic sciences and research, they map to the global north cancers, nothing from the global south. That's the first thing that I want to just raise. And in that regard, I'd like to think of, to invite us to think about reimagining what innovation should look like, as a transformation tool to tackle our complex challenges. And an emerging picture that we're using is mission economics. And I will show in a later slide what we mean by that. Because part of the challenge of using research, science, basic science research to define what the innovation agenda is, you create natural silos. So you speak about health, And therefore, you start thinking this is a biosciences problem. You exclude people who are in quantum computing. You exclude people, maybe the AI guys and the big data guys come in through the back door. But when it comes to who controls and who calls the tune, it's the biosciences people. And yet we know that as far as innovation is concerned, the social sciences and the economists are the people that should be at the forefront. We speak about challenges of commercialization, and I've never been in a room where when this discussion happens, there's an economist, there's a business person, and all of that. How are we going to solve problems that are solvable if we have experts? We're not going to be solving these problems if we're all scientists. It's outside of our capabilities, our realm of capabilities. And I'm thinking that in thinking about innovation, we have to start thinking about a different type of multidisciplinarity to bring in those people that we traditionally think they are not part of the discussion. I don't know if the Department of Science and Innovation, sorry, Ben, I'm putting you on the spot because you put me on the spot before, whether within the department you have people who do economic modeling, people who do market analysis, so that when you invest these massive resources, you invest them with the end in sight. And we use market as a proxy for software, and I think in a lot of companies, when we think about a product, we bring in people who can help define the product. In innovation, we call it ideation, but I find that a lot of the ideation is done by scientists or engineers and those type of people, which is a challenge. In biotechnology is a good place to start in terms of tackling this because of all the sectors in innovation. It's one that involves a lot of industrial sectors as well as social sectors. I've just listed a few down there. Healthcare, biosecurity, food security, and sustainability, environmental sustainability. The advantage or the good thing about it is that the underlying science is the same. And so with the investment in the underlying science of basic research, you get not a twofer, not a threefer, but a manifer. I don't know what the name would be, but a lot of possibilities. So you move from a low base of knowledge creation to a situation where you could, and in the next slide or two, I will provide an indication or an example of what I'm talking about. But biotechnology has the possibility of solving a lot of the problems. And biotechnology, by the way, is a good example of innovation because from the beginning, when biotechnology emerged, in January, I was in Asiloma celebrating the 50th anniversary of biotechnology. From day one, it came up as a way of pivoting life sciences to solve problems. This is from the early 70s. And so it's a good place to start to try and understand what could be done with other technology or engineering verticals. In terms of crafting the problem using mission economics, and remember that the end of innovation is a product or a service. It is not a paper, it's a product or a service. It's not innovation if it does not end in solving a particular problem. It's science or it's research, but if you're talking about innovation, you've got to demonstrate that you've delivered a product or a service. One big societal challenge is universal health coverage. In this country, we're talking about national health insurance as a means of trying to get to the universal health coverage. Now, the discussions around the national health insurance, again, they tend to not include what can universities, what can our research institutions do to achieve this goal. And one of the ways that we can help in achieving this goal is to set ourselves a challenge. I think it was Ben who mentioned that 97% of our APIs are imported. We did an exercise a while back where we modeled the inflation component in pharmaceuticals based on just simply on the exchange rate deterioration between 2001 and this year, or maybe last year. It's 198%. So in other words, if the cost or the price of those products stayed the same wherever they are made, we would still be paying 198% more, not having changed prices where they come from. And that's just one example of vulnerability. But in terms of what I want to demonstrate here is that in healthcare, you have multiple components. So you have components, underlying components such as engineering, innovation, because you have to manufacture these things. You have to make these products, whether they're medical equipment and all of those. That's engineering. Do you know which engineering it is? It's electronic engineering, it's mechanical engineering. It's, I don't know how many of people who work in the healthcare space speak to mechanical engineers, speak to electronic engineers, and all of those. It's just to give you a sense of the complexity of this. Social innovation, healthcare has to be delivered in society. And if you don't have an idea of how to deliver it, you're not going to be able to deliver it. You're going to always have this misalignment. Biotech is a prominent part of the health innovation. And then if you go down, you've got quantum technologies. Our healthcare systems are struggling with managing big data, keeping records and all of those things. AI technology, which I think is overblown at the moment, but it happens in a way when you're trying to mobilize resources. But we have to be very careful about how we are on board revolutionary technologies, chemistry, and you can write and, you know, and I think Unisa and a lot of universities have these capabilities, but they sit in silos because they don't think of things from a mission perspective as well as a product perspective. If you take a glucometer, it's an engineered product. It applies to a health challenge, but it's engineered by electronic engineers and chemical people, chemistry people, and all of that. And if you have it logged onto your network, then you have to bring in quantum technologies and quantum communications. And if you go down, even further down to the level of platforms, not platforms in the traditional sense, therapeutics. Within the therapeutics, you've got a lot of types of therapeutics, including biosimilars or biologics. You also have diagnostics. And then the medical technologies that I spoke about earlier on, such as equipment, devices, and the like. And all of these, and so what happens, again, the question, which is why you need a scholarship, a settled scholarship of innovation, not innovation driven by the latest buzzword. But if you have a settled scholarship to guide policy, right now we're at a point where pandemic preparedness is the be all and end all, to the exclusion of most things. And so when you come with something that could be impactful, it gets ignored because everyone is chasing pandemic preparedness. And it's unfortunate that funding is allocated from a policy perspective from what is empirical evidence, what the biggest voices in the research space say is important. And I feel that innovation is not being given that due. And then the last one that I just wanted to highlight is biosimilars. Biosimilars, by definition, are generics. Generics, we've seen how generics about 2 decades ago transformed the healthcare industry and transformed the equation of accessibility and affordability. With biosimilars, we have not gotten there, but the technologies exist. The only barriers to access to them are political. They are political barriers. They've got nothing to do with science. And that's why having this conversation without social scientists and political scientists is a bit of a, I don't know, it's limited. I almost said it's a waste of time, but it is limiting and limited, not bringing in the people who can help shape the agenda. And I think lastly, just maybe a challenge to UNISA. I said it tongue in cheek earlier that UNISA is the only university which is our university in South Africa. So I'm putting a challenge on the table to say that, and this is a map, a typical map of the London Underground. We did an analysis to say the underground is so complicated. And the question was, which station would you like to land in to be able to get to your destination? So you have limited funds, you get into a cab, a black cab, and which station would you say I want to go to so that I can have access to the other lines, you know? And that station turns out to be King's Cross, St. Pancras. And I'm sure a lot of people who are in the sciences would know it because that's where you get off when you go into the Wellcome Trust and the Creek Institute at St. Pancras. So at St. Pancras, you can get it to everywhere. And I think Prof. Kuchana said they have these labs all over the country. I know they have labs in the main cities and access. Here's the point. Universities are closed places. They still remain ivory towers to this day. If I'm an innovator and I need to have access to technical expertise, it's very difficult to go to, let's say, UCT or to UKZN and all of those universities if I'm in some of the places in this country. And I feel like UNISA could be that place that creates this new model of innovation, but also opens its doors to innovators and entrepreneurs, because we lack that. If I want to get a product improved or engineered and I send it to CSIR, I have to go and apply for money from Ben. And Ben says, I'll come back to you next year. By the time he comes back to me, that market has moved. And we need institutions like UNISA, which is everywhere and is accessible, hopefully, to facilitate this or to play an intermediary role in the innovation discussion, not just discussion, but now that I know they have labs. And for me, it's personal, and Prof. Kuchana would know that some months, years ago, maybe 20, almost 30 years ago, I wanted to open a molecular diagnostic lab. And one, I didn't have market intelligence. The only people who could help me with that was the University of Natal, the then University of Natal. So I walked in all over the university, and I went to the medical school, which I was familiar with. Guys, where can I get information on this? And they sent me to the HIV economics unit, which sat at Howard College at the School of Economics. And I'm like, did these guys really know what I need? But they had the information that I needed to apply for funding at the then business partners and put together a business plan. And that tells you, and I don't know how connected the sciences are to the humanities and to the colleges of business and all of that. So innovation is something for everybody, not just at the ecosystem level, but even at institutional levels, that you cannot have an innovation dialogue without the rest of the university. Thank you.
Thank you very much, Dr. Msomi. We have young minds and old minds. I know those of us not so. One time I was asked in a class when we were forced to introduce entrepreneurship and innovations. I admitted to the class that I have no idea at the time what innovation was. Entrepreneurship, I had never been trained. I had never even sold sweets as a young child. So it challenges us to open up and let the young minds lead us as we try to also navigate. And Dr. Msomi, thank you very much. Innovation is not only for the elite scientists, it's for everyone for it to work. Thank you very much. We're now going to give Lisa, she has the national insight into what is happening in the space of public health advocacy. Thank you very much.
Morning, everybody. I think it's still morning. I am hoping that my presentation will bring to life a little bit of what the previous two presenters have shared, because it relates to the challenges that we are experiencing on the ground, particularly in the cancer space. So let me start by setting the scene a little bit. You heard Ben talk about the leading causes of death. I think you said the top 5, Ben. He did not mention cancer. Now, according to the 2023 South African Health Review, we have a 9% of adult mortality is due to cancer. However, we also know that cancer stats are seriously underreported at the moment. And so it's likely to be quite a lot higher than that. We also have an increasing cancer burden in South Africa due to a number of factors, including increased longevity, which is actually as a result of other technologies that have worked, for example, ARVs, which means people are living longer, and unfortunately, cancer risk does increase with age. We also have lifestyle factors, alcohol, tobacco, lack of exercise, processed foods that are having an impact on cancers, and also infectious diseases. We still have high levels of infectious diseases, you heard that earlier, and those also are linked with cancers, various cancers. And so our cancer burden is increasing. This, of course, then puts a strain on the public healthcare system. So the burden of cancer cannot be adequately measured just by looking at mortality stats, but it's actually the process of treatment of those patients, which can take months or even years, even the patients who are not terminal. Not to mention the psychosocial and economic stress that a cancer diagnosis places on the patient and the family members of that person. Also, cancer is not one disease, and that makes this complex. So there are hundreds of different types of cancers. They are all different. They need different types of screening methods, if screening is even possible. They have different diagnostic procedures, and they have different types of treatments. So it's a complex field. It's not just looking at one illness. And that's also what makes progress so slow sometimes. You can make progress on one type of cancer, but there's still many, many others that have not been attended to. So that's just to give you a little bit of the context. Now let's look at what are the challenges we're experiencing on the ground. Biggest problem that we have in South Africa at the moment is the late stage presentation of most cancers, stage 3 or stage 4, which of course makes it much more difficult to treat, and in some cases not possible to treat at all. So why does this happen? Firstly, we have big knowledge gaps. People don't know what symptoms of some of the common cancers are, let alone symptoms of the less common cancers. There's also a lot of stigma in many of our communities. There's a misconception that cancer is a communicable disease. Still, that belief persists. There's also a link with traditional beliefs that if you have cancer, you've been bewitched. And people don't want to talk about if they or a family member have a cancer diagnosis, if they even know what it is, because many don't. And so people will rather hide it or not go for diagnosis and treatment because they don't want other people to know. We also have our traditional health practitioners as very much a primary healthcare system in our country, as we all know. And many of those practitioners also have knowledge gaps when it comes to being able to recognize the symptoms of, or the signs and symptoms of common cancers, and to refer. We have done some training in the last year with traditional health practitioners and found that it does actually help when they know what they're seeing and can refer, because then instead of going months and months with a cancer that is now progressing before the patient actually gets into the treatment system, they can be referred earlier, even by a traditional health practitioner. We also have poorly trained primary healthcare staff. Amazingly enough, many of the primary healthcare nurses also don't know the symptoms of the most common cancers. And so, for example, a patient that presents with, months and months of coughing will most likely be treated for TB, and only when TB treatment doesn't work, maybe then there'll be a thought that maybe this is lung cancer. And lung cancer being a difficult cancer to treat, you don't want to leave it for 6 to 12 months of TB treatment before investigating it further. We also don't have very good early detection programs within South Africa. So we only really have early detection for breast and cervical cancer, which are the two top cancers in South African women. However, if you go to a local clinic to try and get a pap smear done or a breast exam done, you will discover that it's not so easy. You can be told things like, we don't do them on Tuesdays, or the person who does them is off sick today, or we only do 20 a day and we've already reached our quota. And I'm not just making up one or two examples. We hear these stories all the time. So although we, in theory, have early detection systems, they're not working very well. And even if you are lucky enough to get your pap smear, the chances are that when you go back for your results, they will be lost and you will have to have another one. And sometimes people will have to have 2 or 3 or 4 pap smears before they finally get their results. And by that stage, especially if they're HIV positive, now their cervical cancer has progressed quite significantly. So these are some of the challenges that we are facing on a daily basis. We also have a healthcare system which bases treatment in metropolitan areas. So if you stay in a rural area 3 or 4 hours outside the nearest metropolitan area, and you need to have 6 weeks of daily radiation treatment, it's very difficult because you can't commute daily. It's too expensive, and logistically, it's just never going to work. You might not know anybody in that metropolitan area that you can stay with. Accommodation is prohibitively expensive, especially if you're living on a social grant. And so we have many people who actually default on their treatment because they simply cannot get to the hospitals in order to have their treatment. We have really bad side effects of many of our traditional cancer treatments. And sometimes these are also not managed very well. The oncologists in the public sector are very busy. They are not always able to attend to that. And so patients often feel, because they're not properly educated, that actually this treatment is making them sick and is killing them. They rather take their chances with the cancer. And so people often stop the treatment because they don't understand that it's a short-term side effect problem and the side effects can be managed to a certain extent, and that will pass once the treatment is finished. So there's also a lack of education there. Then we have shortages of drugs, shortages of equipment, shortages of specialists. We have long waiting periods for diagnostics and for treatment, months and months. And so we have many people who are dying unnecessary deaths because we just don't have the infrastructure and the doctors, the specialists available to treat them. We also have palliative care that is very limited within both the public and the private sector. And access to it is also, so knowledge about palliative care is limited, as is access to palliative care. So it's a difficult sector to work in. And these are some of the daily challenges that we are facing. Obviously, not all of these can be dealt with by biotech, but some of them can. And so I just want to share some ideas that we have in terms of what can be done that can take some of this burden off the healthcare system. And of course, as Ben mentioned, prevention is always the best place to start. We already have 2 vaccines in South Africa that can prevent cancer. We have a hepatitis B vaccine, which is given right from the infant stage, which can prevent liver cancer. And that, by the way, was funded over 30 years' work, partly by money from our research department at the Cancer Association of South Africa. That was work done by Professor Q. And then we also have the recently introduced in the last 6-7 years, the HPV vaccine, which is also very safe and effective in terms of preventing cervical cancer. And that there's a continuous effort to get that rolled out, and we are working closely with Department of Health for that. But we need more. There are other vaccines that we could be looking at. For example, which are the cancers, my colleagues mentioned this as well, which are the cancers that occur disproportionately in South Africa, as opposed to in the Northern Hemisphere, where all the vaccines and the treatments are developed? What treatments can we have in South Africa for the South African cancers? And do the South African cancers look the same as the international, the Northern Hemisphere cancers? One of the recent research studies that we funded discovered that there's actually a genetic anomaly in South African Black women's breast cancer that was not previously noted in any of our overseas studies. And so what are the implications of that for screening and for treatment? And so those are the types of questions we also need to be asking. As I said, we've got cancers that are caused by infectious diseases. So, for example, could we look at vaccines for Epstein-Barr virus, to help with Kaposi sarcoma, for example, or even for Helicobacter pylori, which causes gastric cancers? That would help too. If we could just immunize people and prevent them from getting to the point of having the cancer, it would take the pressure off the public healthcare system a lot. And then also, we still have a very high HIV prevalence in South Africa. So how does that impact on people's immune responses to vaccines, firstly, and also to cancer treatment, secondly? We don't have, HIV is not as prevalent in the Northern Hemisphere, so that's not as central in the studies and the research that is done up there. And that could really make a difference in how we deal with cancers in South Africa. In terms of treatment, the big buzzword at the moment is therapeutic vaccines. And again, a lot of that's being developed in the Northern Hemisphere. But what can we say about South African genetics and other comorbidities, such as HIV, that might impact on the effectiveness of those therapeutic vaccines, as well as other treatments like other immunotherapies and so on that are also developed in the Northern Hemisphere, which are very effective, have a much better side effect profile, and so are much more likely to have people complete the course of treatment rather than dropping out due to side effects. So that's just some thoughts that I would like to share with you today. And the question is then, what can we do in South Africa to deal with cancer from a South African perspective that will help the patients, that will help the public sector, and that will make the research come alive and not just stay in dusty old journals? Thank you so much.
Thank you very much. I think they deserve another loud round of applause. Thank you very much. And in fact, I was hoping to pose the questions that they've just answered, what it is that we need to do. And with the help of Dr. Notununu, we will compile. We've seen exactly what areas that we need to speak to have an impact. Where to go? Ben has highlighted the whole range of grants, suppliers, and Dr. Msome has alluded to us what innovation is. It doesn't sit in that fancy laboratory where someone has come up with an idea to look at one gene and publish a paper in Nature. It sits at sitting across with the experts like Lisa to say, what are the problems? Dr. Msomi coincidentally also mentioned, what are the cancers that researchers are looking at? That's a space for research to do exactly that. Look at what we are doing. Ben has highlighted that about 70% of the drugs are not working for us because we are not manufacturing. We are opening our hands to say, please give us the drugs. So these are the challenges that have been highlighted. And I am hopeful that out of this, it's not going to be an imbizo, which ends today. I am committing to open a communication amongst all of them. Dr. Msomi, I'm going to show you the laboratories. We'll make an appointment. We'll go to the laboratories. Lisa, I am going to engage colleagues to say, where and what it is that we need to do and what are the low-hanging fruits. And I am hoping when I make this commitment, I will get support and cooperation. We've heard that there is some funding. We are speaking to one of the catalytic niche areas, and I am inviting colleagues that we take this on and take the management, that there is something that we can do in this space. A low-hanging fruit, Dr. Msomi, what it is, where can we start? Perhaps before I open okay, we'll have exactly 10 minutes to engage. Perhaps maybe let's take this conversation, as I've promised that the three of you will be getting an email to say, let's move forward. Let's not have an embezzle that ends here today. And my scribe is also in agreement, is going to recruit the young minds that we need for innovation. Without much further ado, thank you very much, colleagues. Thank you for honoring the invitation. Thank you for your wealth of expertise and knowledge. We really appreciate. And I am going to open the floor for questions and comments and commitments.
Thank you, Prof, and to your delegates. To your speakers. My question goes to, I suppose, joined to Dr. Msomi and to Ben. Dr. Msomi mentioned that biosimilars are most likely the way to go, and we all probably know that most of these patents of the biologics are coming to an end in the next 5 years or so. But then the question becomes, from the regulatory point of view, and the cost of developing these biosimilars now regulatory, are we ready, Ben, as a country, as a continent, to restructure our legislation and policies to be able to manufacture and to be able to get these biosimilars into the public, because most of them, the hurdles of approval are so high to a point where it becomes impossible to even bring them into the country. And the cost of development, Dr. Msomi, is Africa's funding system ready to now re-engineer its manufacturing systems to be able to allow companies, I suppose, and researchers to come up with new biologics that are in line or similar to the, so that biosimilars on the patents that are falling off from the biologics, cost and regulations.
Thank you so much. In fact, when I came in, Prof, I didn't know what I was coming to do, because normally scientists normally talk above our heads, but I really appreciate the panelists because they spoke to all of us, I think. And you asked, what are the commitments that you want to make? I think I want to make a commitment with Lisa to say that we will invite you to the Unisa Women's Forum. There's a critical point that you just mentioned, that the cancer in South Africa is different. You didn't unpack that, and I feel that you need to come into the women's forums and unpack that, because we keep on hearing that first thing, no, don't do a mammogram because even the test itself causes the cancer. And I'm like, oh my God, this is a disaster. So we need you to come in, because then it will assist in terms of managing cancer, both cervical and breast. So that's my commitment. You'll come to the Women's Forum and we'll deal with this. And I feel also the Men's Forum needs to hear about how to not just the prostate cancer, but also how do you then work with a woman in the house that has cancer? Because remember, you could be sick, but they still want you to cook. They do not understand the aspect of wellness and resting that the body needs for you to actually get better. Thank you so much.
Thank you so much to all three of the panelists for very insightful presentations. I'm hoping I can take you a little bit off course, but related to what you've all spoken to. I'm particularly interested in the implications of the shift within the medical funding space at the moment and what the long-term implications are, and also maybe what the possibilities for actually reconfiguring and being able to support the very different initiatives you all speak to, because I think you've highlighted not only the importance, whether it's around pandemic readiness or generally re-engineering the medical space to be more responsive, but how do we then continue to do that within the context of the current shifts?
Thank you. So mine is comment and questions in between. So in everything that you mentioned, I have noticed that we have entrepreneurs and researchers and policymakers and politicians, like Dr. Msomi said, because I did a study on the anti-proliferation of cells using plant extracts. However, working with plants, they are seasonal, as we all know, and to get cell lines to do research, it's also very expensive. So we end up doing everything within the lab, then we write a paper and everything is done. Then now when I look at entrepreneurs, because they sell products, some of them don't even go to a lab. For instance, looking at Moringa, there were Moringa products everywhere. However, we have ARC where they do research, lab work, where they weigh their tea bags, but then they never reach the market. However, the ones that are for entrepreneurs, they are always there. So in terms of combining the entrepreneurship, research, and political science, because and policymakers, and again with the policymakers, you have a plant which has good plant extracts. However, if you look at them in the wild, they will tell you that it is a protected plant. You cannot do any further research on it. Then comes someone who with agricultural skills and say, no, we can multiply the plant. Then the policy again comes to say, no, you need to have a permit, you need to have plant breeders' rights, then you cannot continue again. Then now when we look at all these challenges, again, we look at IKS, where we look at the indigenous knowledge. When we go to the people we want to investigate, comes IP. We say now, this is their intellectual property. Then if a product comes, where does the royalties go to? Then again, when we want to have commercialized products, patents come in, whereby you need to patent that product, which is another process. So when, in an essence, I'm looking at, we do have the knowledge, we do have our labs, but then there are other aspects that come into play that, how can I put it, to reduce our productivity or our innovation due to all these aspects that always comes in, where I bring the comment from Dr. Msomi to say, we are here, we are all scientists. We know how it is to work in the lab. Someone out there doesn't understand the trial and error. Sometimes the pipette is not working, or the machines are malfunctioning. You need to redo experiments, chemicals are expensive, and so on and so forth. Then the policies come in, they stop you, and all those other acts again that come into play. So sometimes I think some days we need all these subordinates to be in one room so that we can tell them the story from their scientific view, so that they can also know when they put in all these policies and so on and so forth. Thank you.
Thank you very much, Chair, and thank you very much, our panelists. My name is Arusane. The first one, I have a comment and some questions. I think one of the panelists, I think is Mr. Ben, when you mentioned that 70% of our prescribed drugs are not working, I was so worried about that. And now, which is also more worrying now, is that there are studies which are saying some of these antibiotics are found in our wastewater. And the conventional technologies that we have to treat this wastewater, they are not effective in removing some of these antibiotics. Now, it comes the issue now of drug resistance, you see. So if indeed we are finding these antibiotics in our wastewater, and now all the work that is done, because to produce a drug, it takes like somewhere plus, if I'm not, maybe plus or minus 10 years for it to be in the market. So now it's like, if we are drinking some of these antibiotics, and now you go, the doctor prescribed, and now you drink this, and it's like it reverses everything if the society is drinking these antibiotics. So, but the good thing that I've also, when you mentioned in this, I also have some ideas of research now that I think I can explore from here. So another one is, this one is more like a question. I want to know if maybe you can answer it. You said most of these companies, most of the drugs that we consume, they're coming from outside internationally. So I want to know, do we have some companies here in South Africa which are producing these drugs? And if we do have them, because, okay, I know drug resistance is the issue of many things, but the other thing it could be like, if, for example, the drug is written that you're gonna, this is 800 milligrams, and if these companies, they are not producing, if the drug itself is, for example, is 15 milligrams, I could keep on taking those antibiotics, they will never work. And now we'll develop this antibiotics resistance. So now my question is like, do we evaluate, do studies to evaluate these companies, especially that are here in South Africa, to see, just do a random test, to take this, that to see if what they are writing there and what is in the drug itself, is it the right dosage? So, because if it's not the right dosage and these companies are producing these drugs, we'll keep on taking these drugs, and this 70% could even increase to 80%. Yeah, I'll stop there. Thank you so much.
Thank you. Mine is very short. It's actually directed to Miss Lisa. So it's like, how is the collaboration between traditional healers and also cancer progressing, since we know that most of these traditional healers are actually using some of the plant extracts that are well known for curing most of these diseases or infections that are actually there. And then The second one is what are the strategies that are there that can be used to educate both those in the public healthcare and the public and also those that are in healthcare. And lastly, it's just a question for the how has the US aid funding cut from the US affected cancer?
And also the cost of developing drugs, and also the pipeline that has been raised. If we can group that question for one response. And then the other, Prof. Ngubane has invited Lisa. It's one good outcome. Thank you very much for that. And you deserve this prize for asking, for making the very significant impact. If we can give this prize to Ms. Ngubane. And then also the other questions will then be, Lisa, I think there were a number of them for you. And also the drug, if I may quickly steal Ben's moment, if you remember his very first slide was on personalized medicine. We know now that many variants, genetic variants that are there in the global genome, where then they develop the drugs and so forth. The African population has a very diverse, genome, genetically we're very diverse. So we have many variants or mutations that could speak to drug efficacy. Hence, it's one of the key, he said, the genome project is very key, which will allow us to develop tailor-made drugs that would be effective against us. And also in one of the sessions, we need to dispel the myth, I think in the Northwest, people are saying we are drinking ARVs from the water, so we will not be able to get HIV. So these are some of the myths that we as scientists, we as people in the know, should be able to dispel in our communities. The biggest challenge is not so, because already what you get from the water won't be effective to, work on the HIV. The biggest challenge is the metabolites, or when the drugs changes and then we're drinking them, it becomes toxic. That's the biggest concern. It's not to say when we drink a Panadol, we won't get headache, just to put. So that's the aspect we need to dispel, because it can have very bad connotations once communities read that there are ARVs in the water, so it means for them, then they won't get HIV. Sorry, I'm stealing the panelist response time. Thank you very much. I think we should start with you, Ben.
Great, thank you. Thanks very much for the questions. Really interesting bunch of them. And the bottom line, as I see it, is that South Africa is not investing enough into science, technology, and innovation. That's a fundamental challenge that we've got. We've got really innovative people, we've got some great ideas, and we do world-class science here in South Africa. But if we're not investing enough in it, and this ranges from both the IKS side through to the health side, we've got world-class research, but if we're not supporting it adequately, it can't progress to the impact that you're looking for, because generally research is a lot cheaper than innovation. When you need to set up and commercialize and get regulatory approval, you are going to face much greater financial hurdles. We're doing a whole range of things to improve the efficiency of the system. SAPRA, we're developing a digital system to help them speed up their turnaround times. We're looking at that in terms of Department of Agriculture's Act 36. Don't worry about it. So there are a lot of things that we're doing to improve efficiency in the system. We also need private sector to come to the party. It is critical that the public sector, we had 10% budget cuts 2 years ago. This is across the board. because our economy is not doing particularly well. Public sector is being stretched to the absolute limit. There's lots that could be done to improve things, but nevertheless, we're being stretched to the limit. What we need to do is develop partnerships with the private sector, create an environment that is enabling. And one of the things that Unisa and other universities must do is provide training in terms of business skills and entrepreneurship to their postgraduates. Not every postgraduate is interested in becoming an entrepreneur or working in the private sector, but we need to capacitate those students so that they are able to make that choice and will have the necessary skills to do it. We really need the private sector to come to the party, because public sector can't afford to do everything. We need to find the right incentives to enable that. We do have companies in South Africa that are developing and finishing and filling drugs. Aspen is a great example. We do have some companies that are actually taking the step further and developing vaccines and even going to the extent of manufacturing vaccines, but it's a very small group and a select group, and it's incredibly expensive. So it's weighing up the importance of all of these things. With respect to indigenous knowledge-based drugs and treatments, the model that South Africa has developed through my department is where the knowledge holder and their community are central to the decisions associated across the value chain. So it's not the biopiracy model that we're taking, where you give the idea to a pharmaceutical company and they make all the profit and nothing goes back. We are putting the indigenous knowledge knowledge holder at the center of decision making, so that they are always then part of the process, and the royalties then are decided upon by that knowledge holder in amongst the other stakeholders of that value chain. South Africa, I can't go into the detail. South Africa is at the forefront of antimicrobial resistance. In fact, most areas of research, TB, for example, we are best in the world. HIV and AIDS, again, we're amongst the best in the world. We have world-class research, and we are developing things. It is critically important, but ultimately we can't afford to do everything. So we need entrepreneurs to go into the private sector and establish companies and create livelihoods and create wealth and create the products here in South Africa to address the diseases and the challenges that we have. I'll pass on.
Thank you, Ben. I'd like to maybe try and answer Dr. Ntutela's question on why biosimilars have not taken off. But it also, in answering him, I'll address the two questions here, and I think the other one there. That business is politics. Biosimilars have not taken off in the global north. So in other words, in the US itself, they are having a hard time taking off. And you and I both know, having been trained as biotechnologists, that it is not an impossible task to produce these biosimilars. In actual fact, one of the provisions of the patent law in the US allows for competitors to start innovating for a biosimilar or a generic 2 or 3 years before it expires. So there is no shortage of supply or of takers. Where is the shortage? In talking about our own SAPRA or some of the African regulatory authorities, the challenge here is again political, because they rely on the US and on Europe for regulatory processes. Now, Ben's slide, I think it was the last one, had an ecosystem of partners. And one of them is ICGP. And ICGP, if you think about Cuba, if you think about India, their biopharmaceutical industries have traditionally depended on ICGP technologies. The difference between Cuba, India, and ourselves is that their leaders at policy and political level are courageous. They took the right decision. They had the courage to say that biosimilars are going to save lives. Lisa speaks about cancer. A lot of these biosimilars that are very helpful in cancer are already off patent. You know, I said earlier on, I was at Asiloma in January, and we looked at the list of technologies and pharmaceuticals that were off patent, that have been off patent not just for 5 years, but for decades. Insulin is one of them, non-communicables, off patent for over 20 years now. And yet there's no take up by our industry as well. So it's not just politicians, our industry, because there's no reason why Aspen does not invest in an indigenous capability to manufacture these biosimilars, because it doesn't cost them. If they don't want to do R&D investment, they can at least invest in the biosimilar space. And it goes back to the two questions that were asked here. I think I'm just going to point at the straight line. That yes, what you probably do require are more and more engagements between different disciplines. You know, I often say I come from KwaZulu-Natal, and we're currently working on a project to assist the provincial government, Department of Health, because they are sitting under a mountain of debt from litigation, medical negligence. And I believe that this is something that is prevalent, and it's driven by ambulance chasers. Excuse me if there are lawyers here, but these are lawyers who basically are exploiting the system and basically litigating government and getting huge awards. And as a university, we've taken a view that can we use AI to assist our law faculty, to assist government to meet this challenge of these opportunistic legal people. And that's innovation on a social innovation. We're using a scientific technology innovation to address a problem, a real problem, because the KZN Department of Health is bankrupt. Every year when they get money, transfers from national government, the sweets come in, the legal creams come in like nobody's business. And by the time they start, they can't do anything. And this is the role of innovation, among other things. And Unisa, again, it's the University of South Africa, can play a catalytic role in bringing together universities and other role players in society. Because universities, remember, they specialized in certain verticals. No one university has the entire spectrum. They specialize in certain verticals, and you having proximity to society could play a catalytic role in ensuring that other universities and institutions are partners in solving society's problems. In my mind, that's true innovation.
Thanks. On the subject of traditional health practitioners, it's really an interesting question. I'm not aware, I might be wrong, of research that shows that the herbs that they use can cure cancer. I have not seen that. Maybe it's an interesting area of study. At the moment, they may well have anti-cancer properties, some of those herbs, but they may not be used in the right, in the right strengths or for long enough or whatever. And they may also help with a lot of the symptoms, so the pain, the nausea, those type of things, but maybe not cure the actual cancer. Because anecdotally, patients that we work with who have been to traditional health practitioners for some time and end up then in the Western healthcare system have not had their cancers cured by those, whatever methodologies were used there. So, our work with those practitioners at the moment is making them aware of what the most common symptoms are of cancers in men and women. We focus on the top 5 based on the stats from the National Cancer Registry. And, why firstly, what cancer is and how it develops and why it's important to refer as early as possible. That's where our work with them is focusing. But if anybody does know of research on that indigenous knowledge and those indigenous herbs, please do share that with us, because that's something we would really like to know.
It's been such a dynamic, it's across the whole ecosystem where biotechnology should be, from the policy perspective, from the innovation, commercialization, academia, and the problems on the ground. With that, I thank you very much for attending, and a special thank you to our panelists. And I know how busy they all are, but they've graced us with this wealth of expertise. And I will, through Dr. Notu Nunu, we will be sending out, and I'm sure there are other questions in the YouTube that are online. I will be sharing. We will find a platform through the College of Graduate Studies to summarize and also to invite. There's been so many ideas that have, the research questions. What cancers are we looking at as a country? Possible innovations, the bridge between the, the startup of a company and also the indigenous knowledge. So I thank you, everyone. It's not the end, it's the beginning of the journey that we should be taking to address the challenges that have been, and also the possibilities we've had of the wealth of possibilities where we stop the silo mentalities. Scientists think they are there and leave the communities behind, and also leave other colleagues in the other disciplines where we actually really need to get the whole innovation team together. Thank you very much. But before, I think I'm going to ask our scribe to please hand the appreciation gifts. And I think some of them need to declare, so we need a picture so that Ben can show that we are only got a laptop bag. Or thank you very much. Thank you, everyone. Please applaud yourself for being present here. Thank you.
session. I mean, it's cold inside, it's warm outside, and the temptation must surely have been there to just go and relax after a long symposium. So thank you very much for your dedication and commitment to come and join with us, because we are extremely excited to be with you. I don't know if you've sensed that, but that's how the gender tribe rolls. There's a lot of excitement, and we're very happy to be sharing our ideas with you. So it's a wonderful afternoon for us. So I'm going to start off by not knowing what I'm doing. I'm going to give you the questions that we gave the panelists. And we had 5 questions. The first was, has gender mainstreaming diluted the struggle for gender equity? Sorry, I'm Professor Darlene Miller from the Thabo Mbeki African School of Public and International Affairs of Unisa. The second question is, do we still need to struggle for gender equality, or is gender transformation now a slow evolutionary transformation? 3, is patriarchal power the main obstacle to gender equality? 4, could partnerships between feminists, womanists, Posadi groups, and key stakeholders in different sectors, e.g., mining, food, security, heritage, strengthen gender equality in our society? And lastly, almost like a sort of teaser question, is there synergy between time, healing, and the kind of innovation we seek? That question is there because there's a lot of pressure in universities for one to innovate, 4IR, digitalization. And so we feel as gender scholar activists, and some as actual real proper activists, we need to ask that question, is there a synergy between time, healing, and the kind of innovation we seek? For example, 4IR, indigenous time, future time, can those work together, or are they at variance with each other? Or do we feel bifurcated, trifurcated, pulled in different directions? So those are the 5 questions. Because our program is late in the afternoon, we do lose 2 of our panelists by 3 o'clock. So we'll see how it goes, but we might have to let them go early. So we're going to start with those 2 panelists. So the first panelist is Samantha Hargreaves. She gave me such a short bio now, you cheated. Samantha is a long-standing feminist and land activist who has been working on the extractives terrain for the last 12 years. She's the founder and director of the WOMAN, Women in Mining African Alliance. Would you like to stay sitting, Sam, or do you want to come up here? Can we give her a mic if she wants to sit? Do you want the mic? Yeah. I'm not going to switch it off and mess it up.
Okay, great. Okay, well, I'm very happy to be speaking with my sisters. And yeah, thank you very much for being here. So I work for the Women African Alliance, which is an alliance. It's a Pan-African. We have a very clear Pan-African identity. And we work with women affected by big mining and infrastructure operations across the continent. So we have a presence in 17 countries across southern, east, west, and central Africa. So that's a little bit of our background. So I'm going to just dive in, and I wanted to speak a little to the context that we find ourselves in now. And I think we'll all agree that South Africa, our continent, and the world are sitting with a number of interrelated crises. I think we can agree that the world is in crisis, and I certainly think South Africa is in deep crisis as well. And there are different dimensions to the crisis. So obviously we've got the climate and ecological crisis. So Africa is warming faster than anywhere else in the world. We're sitting at around globally an average of about 1.2 degrees of warming. For Africa, that's sitting at around 1.5. So this idea that we're going to keep warming below 1.5 degrees post the industrial revolution is actually nonsensical, because this part of the world, we've already hit 1.5 degrees. Now they're talking about 2 degrees, but actually we're for sure heading to 2 degrees, and Africa will probably be double that. So we are in deep climate crisis. We're in deep ecological crisis, warming oceans, rising sea levels. We're seeing biodiversity losses that have not been seen before. We are talking literally about the loss on this continent alone of thousands of species every year. Now that affects us as human beings because we are reliant, we live interdependent lives. We're not separate from other species. So Western industrialization has seen us, human beings, stepping out of a relationship with nature. And so nature becomes a resource we exploit. And so this has grave consequences for us now, but for future generations. So those are two of the crises. We've obviously got a massive debt crisis. South Africa has just taken on 2 new loans, if you've been following, massive World Bank loan, and now we're taking on a new German loan. With the German loan, we'll be sitting at about 70% of our GDP is sitting in the debt crisis. And that means that our servicing of the debt is going to be increasingly more. So 70% of our income every year is equal to the debt that we owe. And what that means is that public and social services are the areas that get the first cut. So on this continent, the majority of countries are paying so much towards debt servicing, greater than health and education combined, 2 of the most critical areas for investment for human beings and for the next generation. With all of this comes a deepening social reproduction crisis. And what I'm referring to here is the very ability of people to reproduce themselves, meaning to put food on the table, to have an adequate, nutritious diet, to be able to get access to fresh drinking water, access to electricity, access to healthcare and education. It's reaching the point where the majority of Africans are unable to reproduce themselves. And here, if we look in the South African context, it is women-headed households that are carrying the greatest burden of poverty and inequality. And so this burden of inequality and this burden of the social reproductive crisis sits very heavily on the shoulders of Black working class and peasant women. It's not all women, that's for sure. So those are some of the crises that we're sitting with. So I think when we talk about and we think about feminism, we need to be thinking about, does our feminism address these many, many dimensions of crises? And I haven't referred to them all. And they're all interconnected and interrelated. So we have to ask ourselves, what underpins this crisis? Now, obviously, that's the subject of many books. But in summary, our organization attributes this interconnected crises to a few things. We are very clear that this crisis is underpinned by a global economic system, which we are part of and which we replicate, that we call capitalism. So we're very clear that if we're living under a system of capitalism, that system is totally unsustainable, because capital needs production. Capital needs the expansion of the economy, and the economy expands through the production of goods and services, right? Now, a lot of those goods and services that are produced are things that the majority of people don't really need. So, for example, if you think of cell phones, now South Africa doesn't produce cell phones, but we certainly consume cell phones. And so if we're consuming cell phones and we have to have a new phone every year, just think of the sort of environmental crises that is being stimulated there, because it requires and demands the extraction of many minerals to make cell phones. That's just one example. It's the new car that we need. It's the bigger house that we need. It's the fancier foods, the imported foods that we need. Now think of what all of that demands of the environment, of ecology. And so because capital needs a productive system and needs consumption, we're extracting more and more from the environment. Because people want to consume fruits out of season, we now have goods moving around the world with emissions. So these are just some of the examples of unsustainability that the capitalist system produces and reproduces. So with consumption comes a whole lot of costs. So if we're extracting minerals and metals, if we're extracting oil, coal, gas, for the energy that's needed to produce these goods that most people don't really need. We don't need a new phone to have a decent life. We don't need a new car to have a decent life. What a decent life looks like is that everyone has access to the food they need that's nutritious, that's sourced locally, where people can get their goods to market, where people can, where their children are going to school and not having to pay fees. These are the things that the majority of people need. And these are the things that the majority of people do not get under a capitalist system. So we have to fight capitalism if we're actually going to improve the lives of the majority of women, peasant and working class women. Now, underpinning, oh my goodness, oh no. Okay. Yes, it's a, okay, all right. So I just want to make the point that this capitalist system is global and it is imperial. So as much as South Africa was supposedly liberated 26, 27 years ago, we all know that that liberation has not happened. And that is the same across the continent. And so we're sitting with a situation where the majority of African countries are incorporated into this global system on a very unequal basis. Even in South Africa, we are still exporting large amounts of raw materials. In other parts of the continent, it's even worse. As most of the exports are raw materials. So the division of labor globally remains largely unchanged, even since liberation of nations. So the system is racist, it is colonial and imperialist. The global system is all of that, and that has remained largely in place for the last few hundred years, since imperialism started in the 1600s. So those are just a few points around, we have to fight the system as a whole, and we can't just be talking about gender equality. So read together, is the struggle for gender equality enough? Big no. Because we have to be thinking about this bigger picture if women, indeed, the majority of women in the world today are going to be liberated. And that speaks to how we think about feminism, because liberal feminism does not speak to all of these questions that I'm raising. Liberal feminism says that patriarchy is the source of women's oppression. Yes, of course, patriarchy is the source of women's oppression. But when you look at the lives of Black working class and peasant women, there are layers and layers of oppressive systems. So we can't fight one system without considering how all of these systems, the economic system, patriarchy, racism, imperialism, how all of these systems are connected. And so no, gender equality is not enough. So ours is a bigger struggle. So maybe just to conclude then, as women, and this has been the work that I've been doing for the last many decades, we are really clear that the battle must be fought by the majority of people. And so it is women that are carrying the burden of crisis, supported in solidarity by women such as ourselves here, that our role and purpose is to support the organizing and movement building of women that carry the burden of the crisis. We believe that it's not just peasant and working class women don't just carry the crisis. When we think about alternatives, we are very clear as women where I work that the alternatives rest in the lives of the majority of peasant and working class women. Now, I'm not saying that we all need to live in poverty, but if you speak to the majority of women living in rural areas and we think about poverty, women will often say, well, I'm not poor. As long as I have land to produce on, as long as I have access to fresh drinking water, as long as I know that my children in the future will have the land and natural resources they need to live, I am connected to my people. I am living a spiritual life. This is what women will often say. So even how we think about poverty is something that we have to question. We also have to question what is development. The development that we're sitting with, that we're told is development, is a development that destroys. It destroys the lives of people who live on the land. It destroys our lives, even in the urban context where we're middle class, where we're living in houses, we've got our own vehicles. Look at the cancer rates. I can't think of how many people in my life are currently suffering from cancer. Cancer is linked to the food we eat. The food we eat is grown in an industrial agricultural system. So that is extractivist. That industrial agriculture system extracts from the earth. It's monocropping, it's filled with chemicals and pesticides. So again, I'm pointing to all of the connections in how we as women, with our families, but particularly women that are working class and rely on the land for survival, are oppressed every day of their lives. I'm going to leave it there.
Thanks so much, Sam. Our next presenter is Bernadette Muthien. She has held executive positions in academia, civil society, and the public sector in South Africa and abroad, an accomplished facilitator, researcher, and poet with over 200 publications and conference presentations, some of which have been translated into at least 16 other languages. She was the first Fulbright Amy Beale Fellow at Stanford University and holds postgraduate degrees in political science. She serves on various international advisory boards, including the journals Human Security Studies and Journal of Human Security, as well as the International Institute on Peace Education, and I think recently just got appointed to the board of Iziko Museum. Okay, thank you. So this is one of the books that Bernie's published with June Bam, Rethinking Africa, Indigenous Women Reinterpret Southern Africa's Past. My favorite is also the discussion on rematriation here as opposed to repatriation. Exciting stuff, people. Find those books.
That today is an auspicious day. There's a prize. Who can guess what is today? Pan-African Women's Day. So you only get half a prize. Pan-African Women's Day. Okay, so we're celebrating Pan-African Women's Day. You done? Okay, well done. Okay, so in celebration of Pan-African Women's Day, also recognizing the work of all of us here, but the fact that we are not isolated individuals. We don't, I'm going to start rapping now, hip hop. So we don't live in silos or in isolation. We're all connected with one another. So here are my thoughts. I'm speaking with the utmost respect and compassion, like a good African child. And at no stage, no matter what I say, should I hope you be offended. So let me apologize in advance if you are offended. I'm glad to see there are not that many elders here, so the offense will be minimal. Y'all, especially the biotech people, are always going on 4IR, like a chant. Free Mandela, 4IR. So I went to Google Translate to find out what is this Bosadi. Hey, it says it's a Setswana word. It means, and this is Google Translate, don't look at me, vagina. Now, I served on the Civil Rights Commission, and there were some old people there. And if I had to tell them that this word vagina, they would give me a clap. So my humble apologies. It's Google Translate, not Bernadette Muthian. There is a better term in Sepedi, Mosadi, which means women, they say. Again, Google Translate, which is far more polite. These terms, though, are rooted from my internet searches on DuckDuckGo, are rooted in the Bible and biblical studies, as well as in Christian theology, which struck me as really interesting. Over 85, hitting 90% of our country practice Christianity. But a lot of those people are syncretic. In other words, they mix traditional beliefs with Christianity. And you'll find that in Islam as well. I come from the Cape, and there people will go to the dukum to put a spell on you. So this Bosadi refers to the sacred feminine, or Mosadi, women as independent and free of male control and patriarchy. So remember, if you are of faith, if you're not an atheist, then God creates life. So God is sacred. Life is sacred. Women create life. We birth life through our, please forgive me, vaginas. Don't mind if I use the anatomical word vagina. Women give birth. Women are sacred. So we're fine. We give birth. We're sacred. Don't forget. But here's the challenge. Christianity, colonialism, and Sam's patriarchy mostly destroyed our indigenous ways, our values, our philosophies. For this reason, I have abandoned my mother, bless her soul, her Christianity, her Catholicism. I do believe in God, my God. It's either no sex God, because God is not anthropomorphic anyway, if you believe in God. It's definitely not a patriarchal man. I believe in a goddess, one or more, like the indigenous people the world over. Christianity, colonialism, patriarchy stole our lands. It's still largely untransformed, except for the few farms owned, nudge, nudge, wink, wink, by a few cattle lovers. So now around Mosadi, Bosadi, who gets to name and who gets to Google Translate correctly or inaccurately? In our country, 35 languages are spoken, so many I didn't even know, with 12 of them official. Zulu, 1 in 4, 25% speak Zulu, followed by isiXhosa, Diteta isiXhosa kaningi, and Afrikaans. Setswana under 90% and Sepedi under 10%. So when we want to gooi a word in like Bosadi, Mosadi, who decides which language the word must come from? So trans people went to Latin dictionaries and they came up with a cis word, CIS. It sounds like sistoch. Cis, CIS, for being born a woman. So I'm not a woman, I'm a cis woman, to differentiate me from a trans woman. And this imposition, I think, is unconsultative, it's impolite, it's colonizing, all of which is ironic. I'm not cis anything, and I'm just simply a woman with all my intersectional identities. I'm Black, I'm African, I'm indigenous, I'm a poet, I'm a scientist. I do it all like most women. This Mosadi vagina, Mosadi sacred woman, is fine if it gets more Black women on our gender equality camps. We want them in our encampments. But honestly, I truly think we don't need new words anymore. We don't need to emulate colonial patriarchy by planting our stakes on our stolen indigenous lands. Instead, indigenous people, and here comes Mama D's favorite word, rematriation. We bring our indigenous practices, our indigenous sacredness, our philosophies, our land, our agricultural practices, we bring it all home, rematriation, bring it home to the mother, bring it home to the motherland. And this is of critical importance for us. Along with this indigenous gender egalitarianism and social egalitarianism, that's so critical. And this still exists in societies from Algeria, the Berbers, to Zimbabwe, the San, still suffering under colonial impositions. The Khoisan Masan in 6 Southern African countries with elected leaders, no hereditary, you elect your leaders with term limits as servants of the communities. Oma Katrina is a very sweet Oma, is ruling the Kalahari on behalf of her people there. So we rematriate, we affirm that everyone is equal, we make it possible in fact, not only in words, but in fact. Much like our beloved Ubuntu, we walk our talk. Women give birth, women are sacred and at the center of society. Critical importance. Men too are equal. And they must also nurture children and others. And in some societies, these men are called male mothers. Look, male mothers. Everybody must mother in most of these egalitarian societies. Everybody must care for one another. There's no biblical pyramid of the man on top followed by women, children, slaves, or the enslaved and animals. In rematriation, we're all together with respect and compassion. This should be our mantra. This should be our chant. Our most important decolonizing imperative should be rematriation. On gender mainstreaming, I was DDG in the presidency in 2015, the first DDG to do gender mainstreaming. The title literally said gender mainstreaming. And 4 years later, we had this monstrosity of a framework called the Gender Responsive Planning, Budgeting, Monitoring and Evaluation Framework, passed through Parliament and signed by our dearest farmer president. And the struggles continue on all fronts, long walks to freedom. When confused, which at my, in middle age, we often are very confused, I ask Indigenous elders. Usually the answer is both and, not either or. Don't chop it up. Go both and. So we need gender mainstreaming. We need it. It has proved extremely important and successful all over the world and in this country. We also need gender specificity. We need to identify poor, rural women, etc., have specific needs, bigger toilet systems, etc. All of these things contribute to gender transformation, which Mama D says appears like slow evolutionary transition. But let's remember evolution, the birth of stars and planets. It's like magnificently shocking. It can even be seen as violent. Think about the Big Bang, boom. That's like evolution. So birthing is not, it's not a gentle transition. So like we fought apartheid in our classrooms and the streets, we fight patriarchy, which underpins the oppression of women by men, which underpins femicide, gender violence, and horrifically in our country, child abuse. This femicidal patriarchy we fight from the union buildings to parliament to our homes, universities, communities. It is not passive, it is active and intentional. Every day I chant in my active resistance, Pansi patriarchy, Tsek patriarchy. Just as the root of all sacredness is woman and our potential to create life, so too the root of all evil is patriarchy, which is slightly different to Sam, but we're on the same path. And it's this patriarchy which, see, now I lost my train of thought. So patriarchy underpins our and demands our subjugation, our enslavement, and indeed our death. It kills us literally in a number of different ways, including biomedically. And there can be no government of national unity with patriarchy. I'm not serving in no patriarchal government of national unity. So here we have rematriation. We meld modernity and technology in favor of indigenous egalitarianism, bringing home, rematriate. We decolonize, we shed the barbarisms of colonialisms from our minds, our practice, our thinking. Sure. I was going to do a little trick, but I'm not going to do that. Because you said I must finish. Yeah. It's about energy, like when I said we are not individuation. Lend me your hand, my dear. Put it, relax. Okay, so close your eyes. Master's closing your eyes. And then tell me when you can feel my hand above you. I'm going to lower it slowly. Just tell me when you feel. She can feel it already. She feels my energy. This is what we are. We are all connected to one another. Bless you. Powerful energy, nogal. So that was my cool trick. I knew Mamadi would like that. But now I am a poet as well as a trickster. So I would like to conclude with this very short poem. Yesterday, the interplay between the drift of drum, the pluck of double bass, the shepherd kiling his two-tone flock, piano keys riffing, playing the past, answering the future. Two-tone keys played together make music, show the possibility of community. Thank you.
So sorry to interrupt your rhythm there. Okay, so our next speaker is Vanita. Just misplaced your bio. Okay, got it. Apologies. Vanita Daniels is a Black feminist activist championing the rights of women, gender, non-conforming individuals, and youth in various spaces, ranging from community development, training, the union movement, international labor solidarity, and the fight against sexual and gender-based violence. She has over 20 years experience with more than 10 years focusing on the GBVF sector. She's the ex-director of Rise Up Against Gender-Based Violence, an NPO dedicated to eradicating GBVF for vulnerable communities such as women who live and work on the street. She has been an integral part of civil society structures, advocating for the rights of women and children, particularly in the GBVF sector, and served as a civil society representative on the planning committee for the Presidential GBVF Summit held in November 2022.
Thank you, Darlene. Hello, everybody. Gosh, 10 minutes is not enough. So I'm gonna, it's very brutal. So I'm gonna try, and I have a whole 20-page worth of inputs. I'm gonna jump through them. Just to get, I think I'm probably the real activist that Prof. Darlene was referring to when she opened up her session. But let me just give a little bit of background, because I think that will make some sense in terms of, that will inform, that has informed my comments. So one of the things that we used to do at the NGO I used to work at was called Rise Up Against Gender-Based Violence. And we basically assisted women who live and work on the street in some of the CBDs in the country, Johannesburg, Pretoria, Cape Town, and Durban. And through that work, we did a lot of, just to sort of look at the intersectionality of stuff. We dealt with health issues, we dealt with security issues, we dealt with, because we had to deal with the SAPs, we had to deal with sexual reproductive health issues. We dealt with land, we dealt with the environment. I mean, it was just every single thing. And I think even if we still have conversations around whether we should be intersectional or not, we don't have a choice at all about being intersectional or not, because just your being as a Black woman, you are the epitome of intersectionality. We also did a program called, my English. We would rescue women, survivors, and no. So if you were trapped in your home, we did this during COVID level 5. Yes, emergency evacuations. My English left me. So what happened during level 5, when government was making its announcements around the interventions that was available, we realized that once again government is woefully the interventions are woefully inadequate, and government just doesn't understand what is going on, because the intervention from government was, here's a helpline and then you call us if you need help. So what government was saying is, we've literally trapped you with your abuser in your home, because most of our abusers are people that we know and love that are in our homes. It's our brothers, it's our uncles, it's our grandfathers, it's our husbands, it's our children. And so government was saying, in our teeny tiny little homes, because most of us are poor and we're Black and we live in teeny tiny homes or in shacks, you pick up the phone and then you call us, and then whilst your abuser is able to hear you, you tell us that there's something wrong and we'll come in and help you. And so, of course, that wasn't going to work, and we put up, we instituted a WhatsApp line and all other mechanisms for survivors and victims of GBVF to contact us. And we would then go to your home and we would pack you up, and your animals. We even did animals. Yes, it was a white survivor. It was a hamster at the time. And me and my colleagues, I was like, I was like, I'm not having a hamster run around in our car. That thing better be in a cage. Because that's just the rat that went to private school. So yeah, we'd pick you up, we'd take you to a shelter or a safe space, and then that was supposed to be the end of our intervention, but because government interventions are woefully, once again, inadequate, we would still have to do quite a bit of service delivery to that particular survivor once we had put them in a safe space. And then, and this is one of the main components of the work that we did, which is probably why I'm going to focus on maybe just one or two of the questions, because I felt that was covered by a previous speaker. We did what we called tavern dialogues. And so we did that in Cape Town, in Durban, in PE, and in Johannesburg. Yeah, taverns are shebeens. Oh, okay. It's drinking spots. Yeah. Informal, or sort of semi-formal drinking spots where that's in the community. And what would happen is we would identify a few taverns, speak to the tavern owners as well, get their buy-in. Fun fact, over 70% of the tavern owners are women. Majority of tavern owners are, registered tavern owners are women. And so the program would run for about 2 years, and we would go back in that 2 years. We would see them probably about 3 or 4 times a year. We'd speak to the same participants, only men. The only woman in the dialogue would be us. And we talked about how to prevent gender-based violence. And one of the main issues, I can't remember the question specifically now, but the question asked around, I think, patriarchy being the main sort of boogeyman at the moment in terms of gender equality. And I was glad that you raised the issue around capitalism, because in my comments, I was like, patriarchy and capitalism. And within patriarchy, I lumped together the issues around culture and religion. And what we found when we had those discussions with men was a lot of the underpinning towards the violence in terms of GBVF was rooted in these cultural norms and practices and religious norms and practices. I mean, we had one gentleman who, in one of the sessions that we had, he told us. So the way in which the way in which we conducted the dialogues was, we would ask questions and the men would respond and talk. So they basically led the conversation, and then we would capture what they say. And then invariably during the rest of the dialogue, we would pull up, oh, well, you said this. Do you still sort of hold to this thinking because you said this at the beginning of the dialogue. And so one of the things that that the gentleman said was, you know, he wants his woman, like respect was a big thing. Men would always use that word, respect. You need to respect me. And so we would ask, what does that mean? You know? And invariably it meant being a slave, because you needed to cook, you needed to clean, you needed to do all of these duties and tasks and be in servitude of me. With no payment, of course, because it's respectful, it is expected of you. And then what you get in return was a man that ostensibly was supposed to take care of you, right? And so during COVID, so a lot of men lost their jobs. And so at the beginning of the dialogue, they would like, you know, you need to respect me, blah, 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 blah. And then you get in return this man that's going to take care of you and the children, but from a monetary aspect, not emotionally or psychologically. It was really just a monetary aspect, capitalism again. And so during COVID, a lot of men lost their jobs. So then they didn't have money. And so when we were having these dialogues, men would be sitting in this dialogue and they would say, well, my woman doesn't respect me anymore. And then we would go back and we'd be like, okay, but you linked your respect to having money. You don't have any money. So why am I respecting you when you said, oh, Sisi, no, you don't understand, you're twisting my words. And it was a lot of fun being in those dialogues with them. Oh, like future time. I'm telling you, anywho, what came out in those dialogues was, through the dialogues, we did a lot of work in the men's spaces and what is currently happening. And I want us to be very much aware of this. The focus is having male-centered, men-centered conversations. That is leading us into a space where a lot of the focus is going towards working with men and boys, and that's great. We really, really, really need to do that. The challenge that I found and the danger that I've seen is the kinds of conversations that men, because it's men that's doing this work, the kinds of conversations that men are having with each other. So we have conversations that sounds like real men don't rape. Real men take care of their woman. And so it is a reinforcing of patriarchal norms and standards. It's a reinforcing of that societal, of that religious, cultural norms and standards. It's not about dismantling the system. And so for real activists, I'm just kidding. So for activists in the space, it's like, how do we how do we challenge these conversations that is currently having? Because it's even led to a shift in funding. There's a lot of funding that is now shifted towards working with men and boys. And when you are in those conversations with men, there is a lot of woe be to me, we are all pulling the short end of the stick. It's women that is, winning at life at this particular point. And I'm going to end off with this very, very, very small little anecdote from our tavern dialogues. So one of the questions that we ask men is, what is your role in society? And then they would list all of these things. And invariably it was, I'm a leader, I'm a provider, I'm a protector. And then we'd ask them, what is the role of women in society? And then it would be, taking care of the children, cooking, cleaning, all of these servitudal duties that we have to perform. And then we would ask them questions relating to what's currently happening in society, in the country. And then when we have that question, it is very much women are winning. They talk about how even if anything happens, they are never believed. They go to the police station and, they just get arrested. They get all of these false rape claims. Apparently all of the men are in prison for false rape claims. There's not a single actual rapist that is in jail because women just make false rape claims like ad nauseum. And so we go on and on and on. They will go on and on and on and on and on about how terrible it is to be a man right now. And we agree with them, like, yes, you are right, yes, you are right, yes, you are right, etc. And then we have a question at the end of that, and then we'll say, if you had the opportunity right now, right here, to be a woman and not be a man, would you do it? Ah, no, Sissy, no, no. I said, oh, but why? Why would you not want to be a woman if it is so great to be a woman right now? Because you know why. It's never been great, and it is currently not great to be a woman, especially a Black woman.
Thanks, Vanita. We now have our last speaker. Kealibucha Ramaru is a Black African feminist organizer and activist dedicated to advancing social justice, equity, and feminist movement building. Her work is rooted in strengthening collective power, centering marginalized voices, and fostering community-led transformation. With over a decade of experience, she looks a bit on the young side. Feminist Barbie right there. With over a decade of experience in education, feminist organizing, and LGBTQ plus rights advocacy, she has held various roles as the deputy co-head at Equal Education and program manager at the African Gender Institute. Currently, she works as a donor practitioner, as the Democracy and Social Justice Program Manager at the Heinrich Böll Foundation, Cape Town office. As part of her passion work, she supports grassroots initiatives and movements organizing in rural communities through skills exchanges and strategic support.
Thank you so much. Well, I don't even know what I'm going to say after all of that. But I wanted to segue, and when Bernie was speaking, I said, you see, that intergenerational feminist conversation is going to surface. The different multi-generational, the different approaches around, the feminists, and maybe just to kind of segue and speak about this question that you posed around the ideas of feminism, womanism, and Basadi theorizations, which I think are actually really interesting entry points about where we find ourselves and our own understandings of our identities and how we relate to them, whether it's through Black feminism, whether it's through womanism. And maybe there's a different panel discussion that we have about that, because my introduction to feminist scholarship was through what I call the gender mainstreaming feminist circles, all the ones that were, I say, strategically withdrawn from movement work and then placed into these high-level positions in governments. And so a few years later, they reviewed this idea of what gender mainstreaming has meant throughout the years and what impact it's had on feminist organizing, women's organizing. And I think those reflections are very interesting and maybe a good entry point for me to kind of give my input. With my input, I actually want to focus on two particular things, which I think kind of builds off of, or rather, I want to ask questions related to some of the work that Vanita has presented about thinking about gender-based violence, advocacy, and kind of doing this work of challenging and destabilizing patriarchy. And then what the question of tech is in that role. Because I think right now, like one of my co-panelists, Sam, has mentioned, is that globally we're in a very interesting time, that the idea of advocacy, well, it's more than interesting, there's a lot going on. I don't want to get into it, I might cry, that's the problem. So I think my entry point that I want to speak to is to think about the manifestations of anti-gender organizing and how actually there have been alternative universes through the intergender movement that have been built to deepen patriarchy and to actually also counter gender-based violence, advocacy, to counter feminist and womanist and maybe Basadi advocacy around. And often we don't think that they're there, but they've actually done a lot of serious damage. And maybe my entry point is to speak about this question around gender mainstreaming and if it's important and if it's relevant. My sense is always just that at every time and every place, there are particular concepts that are relevant and important for whatever reason. Gender mainstreaming being one of them, cancel culture being another one. I remember there was a time where you're all critically thinking about cancel culture, if it's useful, if it's not. But there was a time when cancel culture was useful, and I'll say why. There was a time where we needed to create mechanisms where we needed people to know that we believe them, and we're willing to build communities where they are protected, and sometimes they don't have to engage with the perpetrators, right? I mean, after a bit of reflection, we realized that maybe what we're creating are smaller communities of perpetrators who do not have the mechanisms to kind of transform. And of course, that's not a complete generosity. We've built different mechanisms. But there is a time where concepts around cancel culture, around gender mainstreaming are relevant. And I think in the context of South Africa, it was in a time where we needed to deepen and actually transform women's representation within institutions. See more women standing up here speaking, seeing women sitting in leadership positions, right? Seeing ourselves in institutions. But what the other part of it has been is that it hasn't created a mechanism where we actually transform institutions, right? So these women are there and they come and then they walk into boardrooms of people who think little of them, who think that they need to be somewhere else, not respecting. They don't respect them by speaking to them here. I'm not going to hear from you, And so what is that? What are these mechanisms and what have they meant in the ways that we can challenge patriarchy? But also how has the anti-rights, the anti-gender actually leverage these loopholes, right? To deepen patriarchy, to deepen division. And tech and the digital space has been one of the ways that they've done it. And I think for a lot of us, it's felt innocent, but it's actually not. It has very deep repercussions. So we have folks like Vanita who are going into taverns and speaking to men and saying, this is not okay, and whatever. Say in a group of 10 men, 2 might walk away transformed or even critically thinking. But at the other end, there's a young boy, your child, who's sitting on the internet and engaging with red pill, green pill, the manosphere, right? So what's his name, that guy? The Andrew Tate. So what we've seen is that the digital space has been a very volatile and often neglected space on how, work around patriarchy or challenging patriarchy, destabilizing patriarchy has happened. And often our references are so far away. We think about the US as an example because of, the removal of Roe versus Wade or, this dismantling of ecosystems that have supported trans folks. But in our own spaces, the way that podcast cultures have actually reinforced this idea of like a gender war, right? Because people speak about this gender war, but what is it? What is the meaning of this gender war? Or are we thinking about, is it a gender war or is it a place where we're trying to think about building spaces where women and men and folks in general can be accountable and actually come into space as human beings and not this person, this man who needs to be respected and this woman who thinks, if I don't, like our mothers used to say, hey, when you can't cook, which man is going to marry you? And then we say, but there are a lot of assumptions in this statement, right? Yes, I'll try and condense it as much as possible. And so the online space has become a deeply volatile space that has limited what we have considered gender transformation or gender equality. I was in an airport one time and there was a kid who looked nothing less than 12 years old on his device with no earphones. And I think he was doom scrolling TikTok. And an Andrew Tate clip came on. Oh, no, it wasn't. It was that Fresh and Fit. Those weird 2 guys who always have these women on the panel. And there's a man must, a woman must, a man must. And I saw this young kid actually stop on this clip and watch all of it, even though he's been doom scrolling around, the entire internet. And for me, the question then becomes these neglected spaces like the online ones because of the generation divide. How much of it is it undoing the critical work of destabilizing patriarchy? it's important, right, that we are in the taverns speaking to older men, knowledgeable men who actually are in homes and setting the tone for young men. But what happens when young men are completely captured by online spaces, right? It's these podcasts like MacG's Podcast and Chill, has been a critical space. And I know a lot of people are sensitive and they say, he has a right to say what he has to, but it's also, the real question is that what kind of damage is coming out of that space? Or the younger versions, because they become younger and younger and younger to appeal to younger folks, right? So there's another one where everything is about smashing this, smashing that. And I always say, we need to get into a generation where we need to start to regulate podcasts because, please, we've had enough. There used to be a very good generative space where people used to learn about interesting things, about Black women who revolutionized or whatever, but they've become very destructive spaces. And maybe to enter in about the potential for research in this space and the entry points is to think about the relationship between gender equality, 4IR, and the algorithm. Because we have literal infrastructure that has been built currently to counter. And a lot of it is racialized. The algorithm itself, right? We're speaking about securitization in other spaces where people want hyper-surveillance. Let's use the algorithm to help us catch criminals. In Cape Town, it's a very popular thing. But meanwhile, what we've seen around the world, and research has shown us that these algorithms are racist, they're anti-women, they're anti-Black, they're anti-poor. And when do we start to kind of take accountability for the online space? And so maybe to close it off, that maybe there was a time where we could have said gender equality or gender transformation can be a slow-moving evolution, but not in the time of the anti-rights. I think that we need to actually critically think, both from a perspective of research, of activism, about what this space is undoing, right? And not just from a gender perspective, it's also from a race perspective. We're seeing an increasing of xenophobia in our spaces, right? Xenophobia, Afrophobia, but we're missing the connection to the global move to the right, that populism is taking over because people are dissatisfied. But how do we also kind of use the mechanisms we have to counter some of that? And I think lastly is the appeal that actually in our households, it is worrisome that we have young kids who are online and they're being called all types of incels, all types of things. And then they become these deeply aggressive young people outside. And it doesn't matter how much of it you champion as a woman in the workplace and you're seeing them, this revolution. My mom is a woman and she's a professor and she takes on these things, but social media has consumed, and has kind of also shifted the kind of relationships that I think a lot of us within the advocacy space have tried to kind of reconcile and shift and critically review. I'll leave it at that.
So we may need TikTok dialogues for the new imperialism. Do you want to take a question? Okay, so we're going to lose Bernie very soon. Is there anybody that wants to direct a question specifically for Bernadette? Is there a mic going around? There isn't another mic?
Thank you for the wonderful conversations. My name is Zagele. I'm having a problem about us women. I write papers. I also talk about patriarchy. I talk about culture and all that. But what I've seen of late is that as women progress to powerful positions, they become enemies to each other. If you look at the violence, I'm doing a research about widowhood issues. If you look at who is perpetrating that violence, it's a woman to another woman. So I think in our dialogues, we need to include the violence that is being perpetrated by women to another woman, instead of pointing fingers to the male figure. Thank you.
Thank you very much. Fortunately, I was online in another venue, so I heard everything. Just to, probably the question put differently, the so-called male-dominated world. I have an advantage. I've been in male-dominated worlds all my life, in the laboratory, in the military. And I want to use the quote of the first female president in Africa from Malawi, who says, and that's why I want her to comment before she leaves. The system takes and puts you there. And I hope Sizakele is listening. What then happens is that this support for you being there is just not there. And when you are there, you are sitting with our brothers. And our brothers, not that they don't want to assist us, but probably the how we get assistance without being seen to having favor being done to us, if you get what I'm saying. How do we develop? Let me be practical. How do we develop a military soldier, a female, to go to Kazakhstan and be able to operate in Kazakhstan without being told, no. Here, we want you to put that attire and you cannot march as a soldier? That's my question. How do we deal with that? Because it is in mining, it is in law, it is in military, and as a result, you find that a person then who is a general in that space has this posture, which in some interpretation, it will be like she's sabotaging others. It is not. It is the environment that the system being put there and no support to deal with you as a woman, expected to carry that gun, which actually was made for another paradigm, not your paradigm. So use that example, you apply it in the fields, and how do we deal with it?
Thanks, Mamadi. I just wanted to say thank you, Sizakele, for raising that question. And it's always interesting. And often it's men who say, but you're talking about sexual harassment of men against women, but you forget that women also, could possibly rape men, etc. So I have only one very simple response to that. It's if you remember that with colonialism, there is always created a comprador class. So the imperialists, the people, and then in the middle there's a buffer class called the comprador class. They are the ones that internalize their own oppression and that help the imperialists to oppress the people. And in the same way, we have Indian mother-in-laws, the widowhood, abuse of widows, etc., by women, because these women have internalized the oppression of patriarchy and they find it very fruitful to beat up other women. I get beaten by my husband, so I'm going to beat Vanita, and she's going to beat the hamster, and so it goes on. So that, in a nutshell, is it. We have to constantly, every day, literally, you have to chant your head. You have to get rid of, decolonize your mindset or consciousness of all the internalized oppression, racism, sexism, homophobia, you name it. Toss it, toss it, toss it. Every day. It's an ongoing endeavor and it never ends. I bet when I'm on my grave bed, is a bed grave? Deathbed, that I'm still going to be doing this work. To the youth.
Sorry. So I wanted to thank you so much to sorry, I didn't get your name. No, that's Sizakele and then this person who spoke after Sizakele. Yo, my hearing is so bad. Thank you so much. I mean, I don't know. I mean, your example, I think, completely grounded it. And maybe I wanted to go back to this idea of gender mainstreaming, right? And how often, what the point was that we wanted gender parity. So let's create all these institutions and spaces where there are no women, so we'll bring women in, right? We bring women in and we make them heads of this, da-da-da-das of this, da-da-das of this. And at the end of the day, women are brought into institutions that where they become the first and the only, right? So I'm the first Black woman to do this, and I call it the first and only syndrome. So the first and only, we're always taught, try to be the first one to do this or the only woman to do this. And so you enter into an environment that completely disregards you as a person, but you're still responsible for that environment, right? And everything around you says, if you lose this, then you make it look bad, because women somehow, we have to represent everybody. If I make a mistake as a woman, every woman is bad, It's the same way when people run institutions, they bring women to kind of fix them. So if there's a big sexual harassment scandal, bring a woman, they'll fix all the issues in there. And I think that we take for granted often the position that women, Black women, queer folks, whoever, who come into institutions, the pressure to be the one and only one, to be the shining star. Because if I underperform, and me, this is not my personal experience, by the way, I can proudly say that every space that I've been in, it's been Black women who've paved the way for me. They've been a good space, a landing space for me, and who've said, you're great, you can do this. But I also know that's not the fact, because often institutions are built on these very white supremacist, capitalist, patriarchal, blah, 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 these big acronyms, right? They feel big, but when they play themselves out internally, that's when you see it. That's when you feel like, I can't ask Mase for help because she's gonna, she'll sabotage me. And it is a real thing that we do need to speak about this thing that women feel like they have to be protective of their space, or else somebody else might take it. But I think it's an indication of exactly what we're speaking to, a system that's fraught with exclusion, that creates minorities, and there has to be shining stars, right? There isn't a space where all women can thrive, can build with each other and support each other. So yes, there should be. And I think, but it also has to be in the context of the conversation that we're speaking to. And I think more than anything that needs to be mentioned here about the idea of patriarchy, right? That patriarchy hurts everybody. It hurts the men who are also sometimes the custodians of it. And I think Vanita's example about the man who says, my role in this house is to be a provider, yours is to take care of the household. What happens to that man? He becomes a victim of his own system when he can no longer provide, right? And I'm going to, yes, okay. I wanted to make
We'll come back to you. Okay, we'll come back to you. Are there other questions? No? Wait, if there are no other questions, then let's give the panelists a chance first to respond. Okay.
I want the best way of relating this. I happen to be very spiritual. And in that space, at some point, we're called by the leaders. And they were like, mothers, these are your kids. What are you doing about this? So I'm saying, oh, you can't hear me? Okay. And the question is then, what has happened to the he for she agenda? There is an assertion that we're busy talking about bring a girl to school. When are we bringing boys to school? Because as a reaction of wanting attention psychologically, which is natural, a child will misbehave because the child wants attention. And I want us to look at the psychosocial impact of some of the initiatives that we're bringing. Thank you.
Thank you. The more people talk, the more questions. Thank you very much, Advocate. In fact, we had just started a program where we were saying, if Vodacom says bring a girl child, we go to MTN, bring a boy child to work. Because some of these, as we try to uplift, we are also doing the damage on the other gender. And also just to extend on Sizagele's comment, one time I was asked to, bring a talk on women development and all, and we coined a term, pull her down syndrome. Once I get the first woman to get a PhD in immunology, I kick the ladder so that I remain the first and the one and only. There are so many examples where we as women still need to, I want to use the term matriarch, work on that. Yes, actually the other aspect, I was talking to honors students discussing the issue of, I don't know, probably you are aware of the girlfriend allowance. It's a trend now. If a boy has a girlfriend, literally has to maintain, they have to maintain the weave, they have to maintain transport and everything else. And I'm asking them, aren't you reversing what we are trying to do to be independent? And the answers were like, no, if he wants me to be pretty, he must maintain my. So there are so many other dynamics that we also still need to take it. Let me end before I go on and on. It's just comments, and also the other flip side of the coin where we are going speaks to capitalism, materialism. If I'm bold like this, then I'm like a nightmare to our young girls. Thank you.
Thank you so much. I just want to get clarification as the questions were coming up. So it occurred to me that I think, well, so I'm just because we are born male or female. So I think this kind of critical view should be put into our conversation when we talk about gender, women, and all of these things. Thank you.
Quick one.
So I think I'm going to start with the last point, human nature. What does that actually mean? Because when we say that people are competing with one another, is it just about women? Isn't it about the type of society that has been created by systems? So if you think of more traditional systems in villages where people cooperate, you share labor, you support one another in the field. If you've got a shortage of sugar, you just go to your neighbor and your neighbor will help you out if they can. So we have societies which are much more cooperative, collective. So even like Ubuntu, you don't find similar concepts in the English language or in the German and French language. These birth themselves in different environments. And so this system that I've mentioned called capitalism, it's about the individual. It's about the individual succeeding, the individual getting that Porsche, that individual getting that beautiful house. And what does that require? It requires that we compete. It's about me. It's no longer about me and my village, my community. It's I think we have to understand, and that's why I agree with you. We grow up in the system that creates who we are. And so I think that's a really important thing to consider. I just want to quickly say that when we look at institutions, so whether that's a corporation or a government department, these institutions are are structured, they have a logic, they function to achieve a very particular purpose. So if you look at a company is structured to ensure maximum efficiency and output so that that company can make profits. That's the whole logic of the system. So again, you're going to have hierarchies, you're going to have the bosses that need to behave in a particular way because you've got to get efficiency and output and delivery. So that whole system motors towards efficiency for profit. If you look at the state, what is the role of the state? So in South Africa, there was a colonial state, and that was there to ensure that the natives kept their place, that they gave up labor, that they paid taxes. There was a lot of violence that accompanied a colonial system. The state there, its purpose was to control people so that the colonial powers could exercise control, ensure they were getting access to natural resources, ensure that people were not mobilizing and rebelling. Apartheid, think of the state it was further developed in support of apartheid. The same logic, control, ensuring that resources get directed to a privileged few, ensuring violence so that black people did not rebel against the system, using extreme violence. So what state did our government inherit? A state that was built for purpose. A purpose that was not about development. It wasn't about meeting basic needs. It wasn't about equity. It wasn't about justice. So we inherit systems, and those systems need to be transformed. And so you can't just put a few black people or put a few black women in an institution that is built for a particular purpose. You have to transform those institutions, and that's our task as activists, as scholar activists, wherever you find yourself. It's about the bigger transformation agenda, not about inserting us into institutions that exist for a very different purpose.
We're going to release Sam. Just give our two leftover panelists, the leftovers, just a quick chance to contribute. Last but not least, thank you so much, Samantha Hargreaves.
Thanks, Darlene. I want to, I'll just say it. Oh, okay. I'm just going to say what I want to say, and I'll deal with the consequences of my words thereafter. So, one of the things that bothers me in a lot of the gender work that I do, I call them red herring conversations, red herring questions. So, for instance, we'll talk about sexual assault statistics. We'll talk about, the crime stats and all of that. And then there'll be a question from the floor around, what about false rape claims? And then we have an entire conversation around false rape claims. We have a debate. We go and find new words. I loved somebody said earlier on, we don't need new words. And so I liken I think in certain sense, I'm a bit jaded at the moment, just because we've been having these conversations over and over and over and over. And we keep having the same conversations. And I find now that we are being drawn into a conversation around, and I said it earlier in my input, that we're having a lot of male-centered conversations, indicative of the bring a boy child to work now. And don't get me wrong, I'm not saying that there's anything wrong with that. There isn't. But what that conversation does is it moves us away from what our actual premise and goal is. And so in one of my previous lifetimes, I was also a quality management specialist. And in quality management, which is very data-driven, you look at results data and process data. So let me make an example. Every year we get matric results, right? And it's only results data. There's never any process data attached to it. So for instance, school A last year had a 97% pass rate. This year, they have an 80% pass rate. That's a drop of 17%. You have no idea why, because you're only focusing on the end result. And if you focused on the process, you would get the result that you want. And so what's happening now a lot of times is we are having results data-driven conversations instead of process data-driven conversations in the gender-based violence, in the GBV space. And I think it takes, we shouldn't, you know, if you look at what is happening in the US right now with Trump and MAGA, and it's been coming on for years. And people laughed it off in the beginning when Trump ran for his first presidential campaign, right? We laughed and we made jokes. And I remember at that particular time, I was already fearful because I'm a big World War I, World War II. I love World War, yes, you know, lots of documentaries, read lots of articles and around just the growth of Nazi party and the fascism, right? And so the thing that people don't realize is these things take years and years and years and years in the making. It's not something that just happened yesterday. It's, for instance, you are allowed to do things to people when you dehumanize them. So when we talk about foreign nationals, for instance, as cockroaches, as amakwerekweres, at some point we are going to look at foreign nationals as not being human. And then we are going to be able to do things to those people that we would not necessarily have done before. And we've already started, because what are we doing now? We are not providing health care. And so the question and the conversation now is around healthcare, but we need to have the conversation around how did we get here? And so the danger, and you know, sometimes I just want to stand and scream. And so I'm like, am I in the twilight zone? Like, are other people not seeing this? You know, we need to ask ourselves all of these seemingly new conversations that we are having, particularly in the GBVF space. Where is it taking us? What is it bringing us? Because if you look at just the crime stats, quarter on quarter on quarter on quarter, it does not change. It stays relatively the same in a, you know, a very narrow band. And so we can then have this conversation around if what we are doing has any impact. And that should probably be the conversation that we are having, because going back to, these are systems that we are operating in. And how are we working towards unmantling and unraveling those very systems? Because you can't want to win games playing by somebody else's rules. And the people who are in power are never just going to hand it to you. And so they create all of these little avenues for us to get distracted in, where we are fighting each other and we are fighting ourselves. And now we're having think pieces written about woman on woman violence. And we are distracted. It's paralysis of analysis. Because, oh, what are we analyzing? Where is it taking us? And I think those are the questions that we have to be asking ourselves. I mean, even something as simple as, okay, my last comment. Even something as simple as healing, for instance. You know, there's lots of conversations around healing for activists in the space. But what is healing? Whose notion of healing? And then we are having think pieces of around healing. And then some of us are just not healing, but we are carrying on and doing the work. So I'm gonna end off. I'm a little bit jaded, so you can catch me afterwards because oh.
A very quick, and maybe I want to pose a question. I just want to throw a question back to the individual who asked the question about human nature versus masculinity, femininity, whatever. I just want to ask this question. So online, there was this young woman who came and said, you know, she had this thing about things that are normal in my household that wouldn't be normal in other people's household, right? So she speaks about how in her household, they have to wear dukes all the time. If one of them cooks, she's a woman, any woman who cooks in the house, they have to taste everybody. No, they have to taste everybody's plates before they cook. And then the third one that she spoke about is how when she gets into the house, they can't sit down until their father sits down. So when the father comes in the house, they have to stand up. And until he sits, they can't sit. Now imagine this. This is in the household. The father leaves and comes into an environment where his director is a woman. He's supposed to get directive from this woman. This is his house, these are his rules, and everybody in his house lives by the same rule. At the same table, there are 10 other men. Say it's a team of 13 people. There are 10 other men who hold very similar rules, notions. This woman in my house, in my presence, a woman must wear a doek. They must stand up before when I sit down, they sit down. And then this woman, say there are 3 women in the team. One of them is the head. And then the other 10, the other 10 are men who hold the same sentiment. This particular woman who is established, who knows what she has to do, now has to be in this institution, whether it's a unit, whether it's whatever it is. And she has to be the person to not only lead this, but to also say, this is what I need from you as an employee or somebody that I manage. And my question to you is, how much of that is rooted in patriarchy? And how much of that is rooted in, and say for whatever reason, there's, the unit doesn't perform. I want to ask you a question about what you think those dynamics mean. So is that human nature, or is it a real question around systemic dynamics, right? You have a woman who's sitting there who is leading 10 men who all have the particular ideas about what a woman is. What does that mean to you? So I just want, you can answer it or not. So I want you to answer your own question. Not yet.
Not right now.
In that team with those 3 women, there's this woman now who's holding this thing. And then there are 3 other women. She's got these 10 men who she needs to push and say, you have to work, right? She has to prove herself to them. And then there are the 2 other women who want to elevate in the space. And she's stuck between these 2 people, right? There's this dynamic of being the only woman, the chair, the whatever, the expectations. And then all these other dynamics. We can engage with it after. I just want to hear your perspective.
So we've been in session since yesterday morning. Next time, we're not going to allow them to put gender right at the end. There's something in that, and that has to stop. We want to be first next time. But having sat in all these sessions, what I found with this session is that there was a spirit in the discussion. There was something beautiful about your commitment to stay here till this time with us, about the integrity and authenticity of our speakers, their commitment, your commitment. So we did something beautiful here this afternoon. So thanks to everybody and thanks to our speakers. And how about we, instead of doing like, the Western way, advocate, how shall we go? Shine. Pan-African Women's Day. Thank you, everyone. I hope you enjoyed this session.
And when it's committed to going from everything.
Thank you so much. That was great. I just wanted to ask, she's going to quote someone. Gonna quote someone.
Okay, I'll have to take it.
It's a little more,